Hi everyone, I'm Dr. Mike Martin, coming to you from the Martin Chiropractic Clinic in Plano. Today we're in one of our examination rooms where we go through the process of starting to answer three key questions about your condition. First, do we think we can help you? And if so, what kind of tests, x-rays, imaging, and whatnot might be necessary to adequately diagnose your condition? And third, what kind of treatments might be necessary and helpful? Spinal conditions, if they're not involving an infection, cancer, systemic or visceral disease, have three basic components. The number one underlying cause is mechanical. If the joints line up good and move well, okay, then use of your body makes them stronger and you get stronger and more durable. If they line up poorly and move poorly, okay, then they cause strain and damage. Now, the strain and damage causes damage to the tissue. The tissue that's damaged is typically the cartilage surface of the joint, the ligaments that surround the joint, the bone underneath the joint, okay? And as that damage adds up, it ultimately becomes arthritic. The tissue damage amounts to two different kinds. One is compression, okay, where it's grinding and putting pressure on it. The second one is tearing, and that's when it wedges open and tears usually the capsule around the joint, the ligaments around the joint. Now that's the second component. The third component is the pain generators. Now the pain generators come in basically three types. Okay, the first one is pressure on the nerves. Okay, second one is irritation of the nerves. Okay, and the third one is inflammation that's a result of the tissue damage. Now in the spine, if you can come in closer, the spine has got joints in the back of the spine and in the front of the spine. In the front of the spine are the discs. In the back of the spine are the facet joints. There are ligaments all over, in between these bumps in the side, in between here, inside the spinal canal, behind the disc, in front of the disc. Any of those can have some tearing and irritation to be a pain generator. The nerves in those get pressed on and pinched, or pulled on and strained, and that's your pain generator. And if the inflammation from the damage to the tissue gets bad enough, that causes pain by itself. If the pain stays at the spine, the problem is in the joints where the pain generator is. And if it goes away from the spine, that means you're irritating these big nerves, makes it a more important condition. So as spinal conditions like this are easy to sort out in the first run, but they can be very complex as we get more into the determination. In terms of treatment, it makes sense that if we treat all three components of your condition, you'll get the longest lasting, quickest relief, okay, and the most durable recovery where you can stay good the longest. And in today's world, we can even do treatments that not only heal the tissue damage, but actually get it to regenerate and regrow to some extent. So this is how we start up figuring out what to do on your condition. These are the three key elements of all spinal conditions: mechanical problems, tissue damage, and the pain generator. If you treat all three, you get better faster, stay better longer. I'm Dr. Mike Martin. I'm your Plano chiropractor, and I want to remind you again to stay healthy, stay strong, and to have some fun.